Thank you for being here today. I really appreciate your time, your patience, your persistence. I'm excited to welcome our guest speaker for this month. This month is supposed to be in May, but here we are in June. That's okay. Robin LaCroix. Robin is one of my favorite people and my former work wife at the VA. We built the Teaching Kitchen program there together, led it nationally, and I'm very excited to have her on today to talk about kind of what she's been doing since then, but also something, she got it going while she was at the VA, but she's kind of made it her own thing now. Um, so welcome. And like I said before, if you're just joining us, if you have any questions, please feel free to pop them in the chat. We might have some time towards the end um, to do some like open Q&A. You can just ask freely if you want to, if you have like a burning question. This is being recorded and I'll post it on the YouTube for anybody who can't make it live, just so they can get the scoop. And yeah, I'm gonna go ahead and open it up to Robin and ask if we'll ask if you'll just share a little bit about why you're here, what you're doing, maybe even your origin story, why you became a dietitian.
Oh, sure. And I'll tie it a little bit to CSA programming and kind of the produce prescription work I've done. I've been a dietitian for about 20 years. I started in clinical and kind of ebbed my way toward, outpatient, and then jumped into the teaching kitchen world about 15 years ago and kind of fell in love with getting people in the kitchen, teaching people to cook. I live in Vermont, and so when I was at the VA hospital, our population is spread pretty wide. So we're in one location, but we have patients kind of 2.5 hours north and almost 2 hours south. So we're really spread out through the state. And we have a state that is pretty supportive of farms and agriculture. And so I learned about this program called the Healthcare Share, which is a program that through the Vermont Youth Conservation Corporation, they are a farm and they would grow vegetables and create a CSA share and then partner with a hospital. The hospital would fund the program. They would provide the CSA bags of veggies. The hospital would pick the patients and deliver them, kind of deliver them to the patients. And I thought, wow, I think we could bring that to the VA. And so I started exploring funding, found that there was a funding source within the VA that I could apply for, applied, got accepted to get grant funding through that. And so we started in 2020, kind of a tough time to start in the spring of 2020, but we made it work. We used outdoor tents, and it was actually a really beautiful way to bring some nice things to 2020. We started with just 20 patients at one location. And when I left the VA about a year ago, we were at about 250 patients at 3 locations. So every year we grew and we actually started partnering with another organization last year I was there. And so that was all farm-based produce prescription, all the bags were the same. The way I integrated teaching kitchen programs into that is that I started by offering just a standalone class where patients could sign up and join. It was always Fridays at 11. They had gotten their CSA share the prior day. And so I was going to meet them. We were all going to kind of bring our shares out and cook together. But it was virtual. It was still 2020. And Melania and I had really built up virtual programming that spring, so I felt really comfortable with it. The challenge is that I would get very low attendance. Our patients, when I looked more at our patient population, especially when I started, they were in like northern Vermont. Many of them didn't even either have internet or use computers. And so I learned pretty quick that I needed to kind of adjust my modality as time went on. So over time, I ended up switching from a standalone class to using the farm's Facebook page and teaching a Facebook Live. At that time, I think I was like 2 to 3 years in. We had 100 patients at the VA, but there was 400 patients in Vermont who were all getting the same share. So I thought, well, I can teach this class live. I can reach my patients, but I can also do kind of some community connection and service and reach these other 300 patients too that could benefit. And so I taught that way for a couple of years. And the nice thing about that is I could teach, I still taught at a standard time if people wanted to join live, but it was saved in a library on their Facebook page. So anyone who had the link could go and watch it if it worked for them to watch it later in the day or later in the week. That evolved until this past year. I'll just kind of stay on track with this teaching kitchen modality. This past year, I chose to leave the VA last spring for a variety of reasons. It wasn't the right fit for me anymore. But the farm asked me to stay on and keep teaching the class. And so I transitioned over to YouTube so that I could do the filming. It helped me to kind of shrink down the timing of the classes a little bit. As you know, like if you're making a soup, you've got 20 minutes of cook time. And so by recording it ahead of time, because I knew I wanted to build a library so people could use this more as a reference. I could cook, stop the camera, have the 20 minutes go by and come back. And so I switched it over to YouTube and kind of built this, using produce playlist on my YouTube channel. And so that's been a neat way to still stay connected with the farm. And then, the neat thing about that is once those resources are built, they can be resources for years. And that really excites me to be able to put time and energy into something that then could touch somebody 3 years from now who's got kale in their CSA and is thinking, what the heck am I supposed to do with this? So that's where the channel is at right now. I also have experience within the VA working with produce prescription debit cards. We had a pilot program at our VAs in Salt Lake City and Houston, and I was quite involved in helping them kind of think about teaching kitchen programming for these patients who were getting a debit card so that they could go to their local grocery store, use their debit card to get fresh fruits and vegetables.
Mhm.
Um, and so that's another thing. If people have questions around that, I could expand on that too.
Fabulous, fabulous. Do you have a idea of how many people have been able to benefit from the video content you created? Like, so versus like having a live thing, right? We can count the participants or we see the participant count. Yeah.
Yeah,
How do you
definitely.
quantify that and how much is
Yes.
it? Curious.
Yeah, so when I was doing it on Facebook, I would say usually views were like, I don't know, 100 to 200 views. It's a little hard.
Okay.
You could look back in and kind of see who watches the whole video versus part of the video. But it is a way to track. So, I mean, even if, I don't know, a quarter of those people watch the full thing, now I'm maybe reaching 50 people versus like the three that were
Hmm.
coming to a class. So it still felt like the reach was growing. And then on YouTube, it gives me the opportunity to look at views um, and
Yeah,
see,
that's
how many people
fantastic.
are watching too.
Yeah. Wonderful, wonderful. So kind of I don't know, some sort of evergreen content, more or less, right?
Hmm.
And so even though people, you might not be interacting with them directly, they're still benefiting from this. Yeah.
Yes.
Do you have any type of direct interaction set up, or is it just the YouTube videos now?
I don't have direct interaction at this time.
Okay.
It's on the possibility for the fall. I might do a live teaching kitchen class with one of our housing associations that gets these shares, which I love that idea. They're getting a share every week, and so we could all kind of come together in their communal kitchen and do some cooking with it.
Hmm. Hmm. Do you ever get requests for specific things, or is it your assessment of what they might be curious about just based on your experience and working with food and teaching kitchens for so long, or do they do they make does the farm maybe, or do their clients request any specific recipes or foods to know more about?
Yeah, great question. And actually, before I left the VA, I was on site every day when the pickup happened. And that was such a great opportunity to talk to the patients. What are you enjoying? What are you making with it? What are you having a hard time using up? And that was a really helpful way to kind of cater how I wanted to teach and what I wanted to teach to. Um, I would just come back to like simple, simple, simple. You're going to have people
Yeah.
join who have a lot of cooking skill, but they're not probably the ones that need the class. And so keeping it as simple as possible and encouraging ways. I focus a lot on just how to cut something, how long it can stay in your fridge, how to store it in your fridge, things like that. But then also how to incorporate things in meals that they're probably already eating rather than kind of a whole new recipe with new ingredients. So I just try to keep it simple as much as possible.
Yeah, no, that makes perfect sense. I have a thought here I'm going to share in just a moment, but I want to ask a question that we have from someone in the chat. Have you found a sweet spot for class length time?
Great question. Um, I would say for a class online, I think an hour is ideal. If patients were cooking along and you already kind of knew them and had engagement and you knew that they were like confident to get through it, you might extend to an hour and a half. Um,
Mhm.
but if you're otherwise I would kind of stick around an hour. For filming video, I really try to stay under 30 minutes. Um, and even less if I can. I think, and
Hmm.
unless you have a big audience who's really engaged already, the longer the class, they might kind of fizzle out.
Right.
So I try to keep it on the shorter side. If you're moving over to hands-on, and many of have experience with this, then more kind of between 1 to 2 hours might be more appropriate, depending on your setup for a hands-on class.
So just kind of the nature of what you're doing and what your audience participation level might be,
Yep.
perhaps. Yeah.
Yep.
Um, I have a question kind of piggybacking on this. For the pre-recorded content, how much recording time do you have versus actually video time? Like, after editing and cutting out the gaps and things, what is
I
kind of the
do
translation
very
there?
little editing. I
Okay.
really
There
edit
you go.
off the first 10 seconds where I'm getting set up in the last 10
Oh,
seconds,
okay.
and I just
Yeah.
piece things together. It's not perfect, and I've had to let go of that and say, it's kind of like my volunteer work right now. It fills me
Fair
up
enough.
to offer this, and so I've had to be gentle on
Mhm.
myself in that it doesn't have to be, top of the line, and I don't edit. I also have been teaching for many years, and so I feel comfortable enough that it doesn't need too much editing. Obviously, we could always, find places, but
Hmm.
I don't do a lot.
Oh, I love to hear that. As we've talked about many, many times here, done is better than perfect, right? Just
100%.
get it out there to the world. You can you can workshop it later if you want,
Yeah,
but
you can
just
always
having
get better with
something
time.
exist,
Yes.
yeah, just having it exist, I think is important enough. Yeah. And naturally, I think we're all inclined to improve, right? I mean, that's the reason all of you are here. I'm going to assume on some level is self-development or professional development. So just by our very nature, the next time we do something, it's going to be a little better. Always is. And it'll get a little
Hmm.
better and a little better, a little better until it's
Hmm.
what we want it to be. And I really quite frankly think maybe it doesn't stop. We just keep getting better or shifting or pivoting, and it's just this giant evolution. Um, yeah, yeah. Even when I find even in my own work, once I get something to a place where I'm like, oh, that's great, I still can't leave it alone. I will still tweak it a little bit. Maybe that's, like what do they say with artists, right? No, don't put one more, put the paintbrush down kind of thing, right?
Hmm. Hmm.
Um, I'm not that great at it myself, but yeah, good enough is good enough.
Yeah,
Just
I think
making
it's a
it
great
work.
lesson for us and our patients, especially around nutrition. As we all know, there's so much this
Hmm.
idealism, and to just show people that there's flexibility and good enough is good enough. And I think it's a good
Yeah.
lesson all around.
Absolutely, absolutely. What the other thing I want to jump back to real quick before I ask the other question in the chat is you mentioned something earlier about the content, right? You'll show people how to use it, how to store it, things like that. And I just think it's worth getting back to basics. Like we might take some of this information as I don't want to say common sense, but maybe it's been ingrained in us for so long and it's just something we don't even think about anymore. We forget that it's not common knowledge. We forget that other people, our clients, our patients don't necessarily know that, right? And they're second guessing things all the time. They don't understand, they've never been educated, they don't have that background. So even just simple messages like that. Yeah, how do you store this safely? Does it work well in the freezer or should you try to eat it up in a few days because it's going to be soggy when you thaw it if you try to freeze it? That kind of thing. And around food safety, I find a lot of clients end up throwing out food early just to be on the safe side when they can keep it safely for 5 to 7 days. They're not sure, so they err on the side of caution and create more food waste and effort for themselves. So I think that's also valuable is just to work in those fundamentals. It doesn't have to be fancy, elaborate cooking, or the latest technique. We don't have to be professional chefs to be able to teach people about food. Yeah.
Hmm. Great point.
Okay. Another question in the chat here. Can you talk about your process for determining what recipes to use? Follow-up question to that would be, are the recipes using 100% of the ingredients in the produce box? What are the most common ingredients in the boxes? You got three for one there.
Great questions. So for determining recipes, I try to focus it more around the style of cooking. So I don't know, say it's beets. So I try to show them like how to roast beets, how to boil beets, and maybe how to, I don't know if I was like going to shred them and put them in a salad or something. But try to kind of focus on methods that then they can learn and then
Mhm.
use the products or the item in different recipes. With kale, I'll show them how to make kale chips, and then maybe we'll saute kale or put it in a soup. So that's kind of how I tend to choose them. I think over time, I've just realized like what I know about certain items and how I tend to like them and eat them. And so I tend to teach to what I'm competent and confident in. Um, Again, simple low volume added ingredients. When I see these like beautiful recipes out there, but you look at the ingredients list and there's a nut and a cheese and a vinegar and
Mm-hmm.
an oil and four different vegetables and three, grain, and it's just overwhelming. And so for someone who's new to cooking, especially, I find it overwhelming. I cook all the time, but for someone who's fairly new, we're really keeping the ingredients to a small number and things they commonly have, I think is really valuable. Um, are
Absolutely.
you using
Yeah.
100% of the ingredients in the box? No. So what I like to do is I take the bag out on the counter when I teach a class and I take all the veggies out. But I've picked usually two recipes that I'm going to cook. And then the nice thing about when I was doing those full classes, they were about 30 minutes. If I had some downtime, I would say, I'm not cooking with carrots today, but I'm going to peel some of mine, cut them up and put them in a glass container to store in the fridge so they're ready for snacking during the day. I'm also going to wash
Hmm.
my lettuce right now and dry it and put it in a bag with a paper towel, and then that's going to be ready in the fridge. So I would show them those simple things that they could do just to kind of do a little prep on their items so their items are ready to
Hmm.
use. Because we're focusing a lot on how it's so easy. If you just take the share and stick it in your fridge, a week's going to go by and you're going to
And
take it
forget
out.
about it. Yeah.
Exactly. Things are slimy. And
Yeah.
so that's how I would use the ingredients I wasn't cooking with. And occasionally there's something that you're not cooking with, but likely there's often a good amount of repetition in a CSA box. And so if
Yeah.
I've cooked with something last week, I'll just reference, you can go back to that video to see what I did with kale last week.
Beautiful. Yeah, beautiful. And I guess hypothetically, if you do this for a year, your content comes around again, right?
Hmm.
Like in terms of the harvest schedule and what's in season when.
Yeah.
Yeah, that's really nice. Yeah, to fall back on that. And I like what you're doing too, like, or I guess your approach here, and to point something out is, like you said, it's not so much about the recipe, but it's almost just giving them ideas for how to integrate this into their own systems already, right? So
Yeah.
don't just get the food and put it in your fridge. Prep it a little bit before you walk away, and that way it's ready when you want it to make
Hmm.
it easier down the road. And just building familiarity too, right? Even if you don't use all the vegetables or the produce, it's kind of like show and tell. You're still talking about it. So that
Hmm.
way, the next time they see it, there will be a little bit of recognition and it won't be quite as daunting, I
Yeah.
think. Even if they didn't cook with it, right? You might have just shared a couple notes on it or given them some ideas.
Yeah.
Yeah. Fabulous. Fabulous. Love that. Um, what can you describe a little bit the type of, and maybe not, because now that it's hands off, you may not get to visualize your participants, so to speak, or the people receiving what you put out into the world. But how would you describe the kind of client that uses this box? Like, is there, a certain demographic they kind of fall into? I know you mentioned like Vermont and the kind of the rural
Mhm.
areas, but any like age range, gender, do you notice any trends around that?
Yeah, great question. So in general, produce prescription boxes are connected with food insecurity in a lot of models, or diet-related chronic disease. Those were kind of the 2 points that we used at the VA, which aligned fairly
Mhm.
well with most of our patient population. We were also tending, I would say age range was like 50 to 75. We would have an occasional 30 or 40-year-old. They might have had a family, but for the most part, we had this kind of 30 to 75-year-old range of people who were
It's a pretty broad range.
accessing. Yeah. And many
Yeah.
households, I would say more households with one or two people living there, often two,
Okay.
than bigger households is what we were seeing. So you definitely want to
Okay.
think about who's your audience and teach in the way that's going to work for that, right? If you have an audience with a lot
Yeah.
of kids involved, you're going to teach quite differently than a household of one or two where you're talking about
Mhm.
kind of smaller portions and how to,
Right.
use leftovers and store things
How
a
to
little bit
save it.
longer.
Yeah. How to
Yeah.
save it for another recipe or something like,
Yep.
yeah,
Yep.
exactly.
And also
Good
thinking
point.
about
Very
what
good point.
tools these people have, right? If food insecurity is something on their list, likely um, finances are a challenge, and so they're not probably having big kitchens with all the tools. And so
Mhm.
talking about a safe knife. You need a good knife when you're handling produce every week, but a good knife doesn't have to be expensive. So supporting
Mhm.
people with that. I really try to keep tools fairly minimally, cutting board knife, baking sheet, saute pan. I do encourage a salad spinner for a program like this. They're not that expensive, and I just find it's a
Mhm.
really pretty reliable way to clean your greens and actually get them dry versus just rinsing them in water. So it's something that I use a lot, and so it's something I encourage. Peeler, And that's
Hmm.
kind of it, right? Keeping it simple.
It doesn't have to be much. Yeah.
Yeah, yeah. If you
Yeah.
have grant funding, sometimes programs pair offering some of these items with the share. And I've done that in prior years where you can offer them a knife, a cutting board, a baking sheet. I often use this half-size baking sheet very often, and it came from a program I
Hmm.
did this in, and the patients loved it, especially for small households. So yeah, thinking about those tools and teaching to what your participants might have can be valuable too.
Yeah, absolutely. I never use a full, it's not even a full, a full sheet,
Hmm.
full size sheet's quite large, right? The half sheet is what we're used to, I think, in home cooking, and the quarter sheet is what we
True,
think of as a half.
true.
Yeah, I use that all the time. I also have
Yeah.
a very tiny oven. So I find when I do cooking classes, just because of the nature of my kitchen, I'm already modifying, so it naturally leads into that conversation anyway, which is more helpful for people than I thought it would have been at the
Hmm.
beginning. Yeah. So that's a great point to bring up. Yeah. Thanks for joining, Lisa. I'm glad you got to catch a snippet of it. Catch the rest of it for a replay. Yeah. Oh, a couple of you got to go. Well, thank you for coming. If you want to catch the end of it, you can always, yeah, watch it later. More questions though. We're certainly not done yet. And I'm glad they got to ask some questions before they had to hop. Um, how do you handle and I think I know the answer to this, but I want you to answer it. How do you handle the variability in terms of like not knowing what you'll get in the produce box? The reason I ask this is, and I know you kind of danced around this in some of the other answers, is I think this causes a lot of anxiety for dietitians entering this space. Like they think, oh, I can partner with a farmer's market or a local farm, but it's it stresses us out to think we don't know what to expect. So how can we plan for it? We have to plan a million things just so we're ready for anything they might have. How do we work with that and have a game plan that makes this a little bit easier and lower stress for us to deliver?
That's such a good question. So a couple things. One, if you're working with a farm, you can ask them a couple days ahead of time what they anticipate will be in the share. And so I've done that in the past. So you can get a few more days than the day that it's dropping off. A couple things might differ, but for the most part, that can be helpful. I also found that, and again, with time, this will help, but kind of building up my core recipes that work well with these types of veggies and kind of thinking through the season and knowing, okay, this is about the time I'm going to make these. So I would already have some recipes kind of top of mind. That being said, they can say you're going to get zucchini and you're expecting two big ones and you get this like little tiny zucchini and you can't make the recipe you hope for and then you have to
Right, right.
shift. But I think by building your base recipes, a lot of them use the same ingredients. So especially like,
Hmm.
olive oil, salt, and pepper, some of your base spices. I almost always had like a lemon and Parmesan cheese around because it felt like those were often going into these types of veggie recipes or
Hmm.
salads. I could make a homemade salad dressing pretty quickly.
Yeah.
So some of the base ingredients you can have around.
Yeah.
Um, so yeah, I think that's definitely really normal, especially early on. Especially, I mean, I was working with like a 12-hour window of kind of getting the share, getting home, and trying to teach the next morning.
Hmm.
Did have the flexibility to run to the store that morning if I needed to. So if you
Hmm.
have that in there, but I would kind of build your base recipes ahead of time so that even if that's the process, once you get the veggies, you're like, okay, here's my two recipes I'm going to make. You're not now searching like Google for the right recipe, right? You're
Yeah.
confident and competent in the recipes that you're going
Right,
to make
right.
already, and you can just pick from them.
How many base recipes would you suggest we have?
Hmm. I would have 2 to 3 per vegetable item.
Okay.
And so,
Yeah.
like, and the farm could probably give you, like, here's the 20 things you're going to see over the course of the season. They
Right. So it's
know
not
that
like every
already.
vegetable ever. Right. Yeah.
Exactly. They know what they're going to get. And they could even probably tell you, like, they're probably going to get this for 4 to 6 weeks, or this is going to be a
Hmm.
1 or 2 time. Like, we used to get shishito peppers. We would
Hmm.
get them like once a season. So I just knew I had one way to cook them. I was going to cook it every time we got them, didn't need anything else. So I would probably do that ahead of time. But definitely, like, yeah, at least 2 methods per item, I think is
Okay.
valuable.
Yeah. So kind of like a parallel here, kind of like we're not teaching to a very specific cooking style, like technique. We're keeping that flexible. We're also keeping the recipes themselves flexible, right? So
Mhm.
it's, I think having a nice base. So like you said, like if you know what vegetables they're doing ahead of time, 40 vegetables times two recipes each at 80 recipes, that's still quite a lot. But I'm sure there's recipes you can you can adapt really easily to, like, maybe you have a pesto, and if maybe it's a spinach pesto, but if you get kale, use kale instead, that kind of thing. So I'm sure there's quite a bit of overlap, I'm guessing.
100%.
Yeah.
100%. Yep.
Yeah. In the
Yeah, you'll have
flexibility of
categories.
what you get versus what you can use. And that right there too is probably a really wonderful teaching tool so people don't get hung up on that one ingredient.
Yes, yes. It's
Yeah.
pretty clear cut too, especially with the seasonal CSA, like spring, summer, fall. You're going to see a different pool of
Hmm.
veggies in each of those seasons. And so you might
Yeah.
even break it up by those seasons.
Fabulous. Okay. Let's see. Another question. Oh, an additive to the conversation, not a question. I think we could also talk about other foods they can use instead. So using it as an opportunity to discuss the possible swaps, like
Hmm.
thinking of foods as maybe kind of categories of foods instead, like greens are greens are greens are greens,
Yep,
right? Whether they're
yep,
spinach greens or beet greens or kale greens, that kind of
yep.
thing. Yeah. So they start to think of food differently. I think that's a big thing, quite frankly, what you're doing here, Robin, with this type of program that maybe wasn't the initial goal, but I think is a really lovely goal now is
Hmm.
helping people reframe that entire thought process around food.
Yeah.
Yeah,
And
I
it's a
think
good
that's incredible.
opportunity to talk about substitutions and swaps too. Oftentimes I would be out of something and then I would talk about what I would do instead. Do I leave it out? Do I swap for something
Mm-hmm.
else? And I want them to see like real life around that because that's what they're going to face in their own kitchens.
Absolutely. Absolutely. I really do think that's the gold. I really do.
Hmm.
Yep. Um, what are some of the and I think, just use your own experience with this. What are some of the barriers a practitioner might run into when trying to integrate into this type of program, like get going with a CSA box or even just a local farm or a farmer's market? Anything that you've encountered personally and worked around, or just that you've seen kind of in practice, and how would we get around those or work through them?
Yeah, definitely. I know. As I was thinking through these questions, one thing that kept coming up a lot for me was a pathway. And so, really, there's a
Mm-hmm.
lot of steps in a program like this, right? There's the farm side, there's the growing the veggies, packing them, delivering them to the location. There's the clinical side of identifying the patients, coordinating them to come do pickups. And then there's the teaching side of supporting your patients with what they're going to do with the food. And so, you really need like a clear cut pathway and you need multiple people to do different things. A common
Mm-hmm.
challenge is that we take all of it on, and that's not going to work in something like this. You really want to focus on trying to stay in your lane. Um, it doesn't take a lot of volume of staff, but it takes a good amount of varied staff that can all offer a little bit. And so, like the
Mm-hmm.
farm obviously needs the volume because they're producing a lot. From the clinic standpoint, it's going to take multiple point people. We involved a social worker on our team with a dietitian to kind of help with identifying patients, help with the coordination that day. And then you have to involve your kind of marketing to your whole healthcare team to help
Mm-hmm.
recruit
Mm-hmm.
patients and refer patients. Um, and then obviously the teaching side is going to fall more in the realm of the dietitian. But really, those other pieces pull in other people. People love to help with this type of a program if they kind of know what to do. So you might help kind of like write down the pathway and then
Mm-hmm.
pull in the people that are there to help.
Wonderful. Yeah, it doesn't have to be a one person show by any means.
Yeah.
And
Yes.
if you guys, I don't know if you're newer to Infuse or not, but we do have a prior Infuse call recording if you go to the YouTube channel on having kind of like your elevator pitch, so to speak, for building this up and getting other partners and making those connections so it is collaborative and you don't have to bear the weight of everything. So
Hmm.
that might be a nice replay for you guys if you want to look into that a little bit more. Um, but very, very good point, Robin. What kind of to that point, how would you how would you position this if you were like you've already done this, how would you position this if you were starting over in a new healthcare system and you wanted to start this program again and you were a clinical dietitian or an outpatient dietitian, you were already working in the healthcare system. What would you do first and how would you kind of make the case to get
Hmm.
support?
Yeah. I would start by just pulling some research on produce prescription programs. There's a good amount of papers out there and kind of pull some
Okay.
quotes and data. I would also, cost is always a tricky thing when it comes to this type of programming, but I think we can get
Hmm.
people thinking big picture. And when we think about lifestyle change and what we're putting in our bodies and body weight of
Yeah.
populations, GLP-1s are a big topic right now within healthcare institutions, and they're also incredibly expensive. And so the first thought that comes to me is, can we think about kind of from a cost comparison? I mean, a CSA share costs about $30 a week. That's significantly less than the cost of a GLP-1. Obviously, they're not going to do the same things. But if we're looking
Yeah.
at lifestyle change and behavior change and way to support people to be
Hmm.
healthier and support a healthy body weight and health conditions, this could potentially fall in a similar conversation. And so bringing it
Hmm.
in from a cost standpoint to think about that might be a valuable thing if it's something that you're
Hmm.
interested in doing. I also think
Hmm.
this tells a really good story, right? Healthcare institutions often have like they love good press and to show that you are
They
providing
do.
fresh vegetables to your patients and they're enjoying it is really good press. And so that's a potential to think about when you're talking to leadership. It also
Hmm.
does more than just feed our patients. It builds social connection. Patients are now regularly having like a point of contact with your healthcare team because they're picking up their veggies every week. It was really helpful for our social workers specifically to kind of have an eye on these patients who were coming every week, specifically when we piloted a winter share of this. Otherwise, we might not see these
Ooh.
patients all winter. And now it's getting them
Right.
out of the
Yeah.
house. They're having a social interaction. There was a lot of value that came out of it that we might not have even expected. And so we can kind of, and some of the papers that you'll pull will have some of that as well. But I think there's
Yeah.
a lot of points you can point to. It's not going to be an easy like, oh, this will save you tons of money, but here's all the benefits
Mhm.
that will come along the way, and in the long term, it might.
Yeah, yeah, looking at the big, the broader
Hmm.
picture of health. Yeah.
Yeah.
I really like what you said there too about they do always like good press. Yeah.
Hmm.
And it's not even and it's not I don't want to try well, I want to say this carefully. It's not fake good press, if you know what I mean. Like it's not just showboating. This
Yep.
is a very real program that is having a very real impact in people's
Yep.
lives. And I think, like you said, it gets people coming back to the clinic more often. So there is a touch point, and that probably helps a lot with continuity of care and also
Hmm.
building trust with their healthcare team, which I think is, that's a big thing in public health and healthcare anyway, and it has been for a while now. I think it's just getting I don't know, maybe worse as time goes on, but there's mistrust in public
Hmm.
institutions and that's growing a little bit. So finding ways to reconnect and um, pull folks back in and say, no, we really do want to help you. We're listening to you. Here's some
Yeah.
food now.
Yeah.
You know,
Or even saying, I want to start with 20 patients. Like, let me pilot this with 20 patients and I'll come
yeah,
back to you in 6 months and I'll give you the data of how it went. Right.
there you go. Yeah, starting small. It doesn't have to be the big elaborate thing yet. Just get
Hmm.
it started. Just get it started. Yeah. Theme that came back around there. Thanks for that, Robin. I
Hmm.
appreciate your thoughts on it. Um, let's see. I have a question, and if you don't have an answer for this, that's fine. But I think it does. Like, this is another one that I think swirls around in the back of our heads. If you were a dietitian with, say, a private practice, you don't have an organization behind you, and you thought this might be a good opportunity to partner, but because it's your time and energy, and you're your own boss, you got to make your own money. How would you approach this from a financial perspective of making it kind of worth your time as a
Mm,
dietitian?
great question. So the first thing that comes to mind is find, see what's going on in your area. So find a
Okay.
farm that's already offering a CSA. And maybe you're going to contribute a recipe to their newsletter and they're going to put your information on there about your resources. Maybe you want to set up a table one time at their CSA pickup and do a recipe demo, and you have
Mm,
information about your services. Um, so I would just start by connecting with the program that's already there, um, and see what you can do in kind of a small volume, but also connect it with what your larger goal is.
yeah. Do you think there's opportunities with this kind of relationship to have some sort of monetized offer, like where the CSA or the farm pays you to do a demo or pays you for a particular piece of content?
I think they would likely offer you a free CSA share in return
Okay.
for your
A
services.
barter
A bartering
arrangement.
option. That's been my experience.
Yeah.
But they're
Yeah.
also, the farms I've worked with are often keeping their eye out for grants and applying for grants. And so once you're on their
Mm-hmm.
radar, I just had a farm and apply for a grant to include me in some education instruction that will be paid. And so now
Okay.
you're on their radar and now you can be kind of looped into potential grant opportunities in the
Right.
future.
So there is potential for
Yep.
compensation, maybe
Yep.
not directly from the farm, but yeah,
Probably
through a
not. The
grant.
finances, yeah, most farms are
Yeah.
tight for that kind of stuff.
Yeah. I know we've had questions, it's been a few months now. I know we've had questions from past participants around, this kind of thing. And I did get a sense like they're looking to find it to be some sort of financially viable
Okay.
opportunity. But I like what you mentioned. There's different entry points, right? Based on what resource you have in more abundance. If the money piece isn't a big deal for you and you have time or recipes to devote, that's how you can kind of make your entry point. I think being open to negotiation probably and just finding people to talk to, putting yourself out there,
Hmm.
worst they can say is no. And then you can offer, some sort of parting thing, like a small recipe or something like that.
Yeah, yeah,
But
yeah.
yeah,
Definitely think
even
about
just
what
the
your
free.
goal is. Um,
Yeah,
yeah,
that's a good point. Depends on what your goal is for the partnership.
yeah.
Um, barring a very generous grant, I would say this is probably just a way to get ourselves in front of more people and
Hmm.
make those connections. And like you said at the beginning, like when you create content with your YouTube videos, it's really cool to think that that can help people years from now that you might not even know about. And I just want to point out that even having a pop-up demo at when they pick up their farm boxes might have a similar effect, right? Those people might not interact with you right away, but they'll remember you
Hmm.
and they might come back in a few years and say, "Hey, I've been following along," or "Hey, you said something to me,
Hmm.
and now I eat kale. I never liked kale before. I wouldn't touch it."
Yeah.
So we just never know how much of a profound impact we're making, and I think we tend to assume we're not. Maybe this is just me speaking. I tend to assume I'm not making that much of an impact when in fact what I say might stick around and it just comes back later. Someone said
Hmm.
to me recently, say what you need to say, even if the person isn't ready to hear it right now. They might be ready to hear it later and they'll hear it then.
Yeah. Yeah.
I thought that
I
was
think that's common. I
a
feel like
nice take.
especially in our field, we've all spent time putting a lot of time into something. Maybe did a health fair or something years ago that you felt like,
Hmm.
oh gosh, two people stopped by. Like, did that do anything? And sometimes it probably didn't do much, and sometimes it might have. But as you go, you can kind of think, okay, what am I willing to put in for the potential to get out of it? And there's going to be some things that don't offer as much, and then there's going to be some things that really connect with people. So, yeah.
Absolutely. Yeah. I think part of this is just getting out there and
Hmm.
trying things on for size.
Hmm.
Yeah. See if it fits. And if it fits, it could be a really wonderful relationship. Yeah.
Hmm.
Um, All right. I'm just looking at the time here, seeing what I want to prioritize from you. We don't have any other questions in the chat. Um, so what what skills beyond just nutrition, so like thinking of what we would get in our dietetics background without, knowing anyone's experiential background, what skills beyond just the nutrition piece do you feel like dietitians or health professionals would want to develop or could develop through this kind of work?
Hmm.
Like
I mean, definitely
anything
you're
you
only.
would want as a prerequisite, not a prerequisite, but want to have some base skills for, or something we might get out of this from a skill perspective.
Yeah, I would just say from a culinary perspective, I mean, I've become a much better cook, a home cook, through
Yeah.
teaching all of this. And so if you're kind of new in your own cooking journey, just continuing to cook, and continuing to use the types of items that you're going to potentially be teaching with. The more you can get
Hmm.
comfortable, the more you'll be comfortable in your setting when you're cooking with other people, practicing your own knife skills, practicing kind of troubleshooting when things go awry. I've had plenty of things go awry in classes, out of classes. And so sometimes we just laugh it off. Sometimes we help people think like, okay, if this happened at home, what would you do?
Yeah.
And so, yeah, I would say from a culinary perspective, that's a great place to get started. I think some kind of baseline, patient education, motivational interviewing skills we don't want to just be talking at people the whole time, right? We really want to pull
Mhm.
people in and ask questions so they start thinking about their own cooking experience in their own kitchens, and then they're going to be able to apply this work to their own life, versus kind of seeing us in a different scenario than is their home, and they won't relate to it as much. So being able to kind of pull from them, asking, really engaging questions that are getting them thinking, I think is another really valuable skill that comes with this.
Absolutely. Absolutely.
Hmm.
And I think that's something that shines particularly well in any kind of culinary medicine uh, offer. I've found it just
Hmm.
I think there's just more opportunity for it, and maybe even us as clinicians are a little bit more humanized
Hmm.
when we're doing the things that humans do,
Yes, yes.
cooking and eating.
Yeah. The other
Yeah.
thing I guess I would say is I don't talk about nutrition that much when I teach. And sometimes I say this quietly because I feel like I should talk about nutrition more. But I say that because the nutrition comes with this, right? What people don't eat because eat like long term, and you guys all know this, I'm preaching to the choir, because something's nutritious for us. They eat because they
Hmm.
like the experience and the taste and the
Hmm.
texture and how it feels in their body. And so I talk about food and I talk about taste and texture and smell and our senses and how the food feels in their body and hunger and fullness and incorporating food in a way that they look forward to eating it. And so I focus more on that than I do the nutrition. I'll talk about things when they
Hmm.
come up, right? We'll talk about fiber when we're talking about grains. We talk about that kind of stuff, but it's less nutrition heavy than I would probably anticipated coming out of school and envisioned doing this.
Mm-hmm. I have to say the same exact thing. Yeah. I don't actually talk about the nutrition piece that much. Yeah, very much the same. Thank you for sharing that.
Hmm.
That might have already answered this next question, but I'm going to ask it anyway. What's one thing you'd wish you knew back when you started this work that you know now?
Mm. You don't have to know it all to get started.
That's a good one.
You don't have to do it all by yourself. Reach out, ask for
Hmm.
help, find out who else wants to kind of partner with you and be on a team with you. Um, and yeah, just start where you're at. And I have to tell myself that a lot, even now, as I explore into kind of new avenues. We don't have to have it all figured out to get started. Just getting started is the most important spot.
Lovely, lovely. Um, all right. Well, on that note, I think we'll kind of conclude the interview piece of this. I just have a few little announcements to make at the end of this call for an upcoming event. But thank you so much for your time today, Robin. I appreciate you coming and showing up twice since the first one didn't take. I'm glad this one took.
Yes, it was my pleasure to be
Um,
here. If anyone has questions, please feel free to reach out to me. I can put my email in the chat if that's helpful. I'm always happy to connect.
Yeah. And you can find her on LinkedIn, Robin LaCroix, and we popped her YouTube channel in there too. You can follow her YouTube channel. Yeah, Robin is wonderful. Keep her in your circle.
Mm.
Okay, guys, I just want to share a little thing I've put together here. This is not our next Infuse call. This is my next iteration of the mastermind. So let me screen share here, and I'm gonna show you this fun thing. All right. Here we go. My whole screen. Oh, no, I shared the right screen. Very good. So I decided instead of a big, long mastermind thing that's a huge commitment and maybe a little bit daunting, a mastermind day. This is where we do it all in one day, one very intensive, very focused and structured session, um, so that you can build or tweak the teaching kitchen that you have and make it so that it actually drives the behavior change you're looking for. What this is focused around is outcomes. Um, the experience is part of that. So what we're doing is we're taking whatever program you have, whether it exists in the tangible world or just exists in your head, either one works. And we're going to workshop it. We're going to kind of do an audit. I thought about not using that word because I think audit doesn't sound very friendly, but we're going to take a look at the program and identify where the gaps are that's keeping you from having the impact on your clients or patients that you want to have. Oops, I hit the space bar. It's going to be 4 hours total. We will have a little break in there, so you'll have time to stretch. I'm not going to just hold you hostage for 4 hours. And it's going to be July 11th. Um, 4 hours total, and this will be the debut of my Infuse framework that I've been working on for the last couple of years. So it's a six principle methodology for designing culinary medicine experiences that drive sustainable behavior change. And the whole point of this is that it's more than just what we're teaching, kind of like we were just talking about with Robin. It's not the nutrition piece, but it is the nutrition, but it's the reality of it in people's lives. And what we're really doing is creating an experience that's going to be memorable for them. So that what we do in the space that we have them will have an impact on years to come. When they think of food, when they go grocery shopping, when they plan their meals, they're going to do something a little bit differently than they did before, just because of the experience you created. So we'll get clarity on what you'll get clarity on what to change or improve or build next if you're kind of at that point. We'll get to complete the Teaching Kitchen audit worksheet together. So you'll have pretty much at the end of the 4 hours a personalized roadmap to build out this program or make adjustments to this program. And then an understanding of that Infuse framework and how to apply it. So what you'll get in this, you can apply to whatever you're currently doing, but you'll also have the framework to take with you to whatever you decide to create in the future. This is going to be very practically based. The idea behind this as well is to also create a program that is sustainable, not just from the behavior change perspective, but also for you as the facilitator. Because that's another big thing of this is, big thing about this, I think, is we have these ideas, but we are all tired too. We are all going through our own transitions. We have all experienced different things, and it takes a lot of us to put this out. So we want to make sure that we design a program in such a fashion that it works on our strengths and we are not burning ourselves out in the process so we can continue to show up and serve and maybe even design it in such a way that we don't have to be the one running the show like we just talked about with Robin, bring in other people, make partnerships, have collaboration so that maybe you can build something that can exist without you if you don't want to have, this thing sucking all your energy. So there is a way to do that, and we'll go through that as well. So just a little bit, this is just the quick and dirty Infuse framework, just because I'm very set on the word infuse apparently. So that's what I built it around. And it is for dietitians and health professionals who are running a teaching kitchen or culinary medicine program or want to create one, especially one that drives those experiences, real sustainable behavior change. This is not something we want people to just do once and then move on with their life. We want people to start changing the way they act and think and behave around food again and again and again, right? Repeatable behaviors, not just, oh, that was a cool class, and then they never make pesto again. That kind of thing, Um, not just a one-time event, but shifting their perspective. So Saturday, July 11th, it'll be from 12 to 4 p.m. EST. I put it right in the middle of the day, so whatever time zone you're in, hopefully you're awake by then. It will be virtual via Zoom, but it will be very interactive. The investment is $279. And I have not released this to the great wide world yet. You guys are the first ones to hear about this. So if this sounds appealing to you, um, jump on it. I don't have a cap, but I probably will cap it somewhere around 10 to 12 people, just so I can make sure there's enough of me to go around, more or less. I think more than that, it's going to be difficult for me to give everyone the experience I want them to have in this engagement. So I think Leanne can pop. Oh, Leanne popped a link to this page right here I'm showing you in the chat. So if you want to grab that, you can take a look yourself. I'll probably be sending it out over email later this month anyway. But yeah, you get first dibs if you want to check it out, and then you can just click here to register if you're like, yes, this is what I need, I'm in. If you have any other questions about this, please don't hesitate to reach out. You can always respond to any of the emails I send out. Some of them are automated just for volume's sake, but they all come from me. So you can respond to any of them and it will come to me again, and I will answer you. But that is that. I think it's going to be a great day. I hope you'll join me, and you can claim 4 CEs from that. So, why not? Win-win, I think, all around. And I think that's it for today. One more minute to go. Our June call, just as another quick plug, I don't have a I don't have a screen for this, so I'm just going to say it. Our June Infuse call is going to be on Tuesday, the 16th. So hope to see some of you guys back then. And if not, it will also be recorded, so you can also catch the replay. But I love the live vibe. I have a hard time doing what Robin does and just creating content and putting it out there for someone to benefit from indirectly. I really feed off the energy of people in the room. So I really appreciate having folks on the calls too. Not that I'm like, don't come out of pity, please. But what I'm trying to say is I appreciate your presence here and your time today. Thank you. Thank you for being here. And thank you again, Robin, for being here too. It's good to see you again.
Thank you. You as well.
All right, guys. Um, any last thoughts? Okay. All right, guys. I think that's it. Thanks for being here. Have a great rest of your week and see you again soon. Bye, everyone.